Good people don't smoke marijuana.
I've known Larry for a long time.
Quiet, numbskulls, I'm broadcasting.
This is the Medical Marijuana Radio Show with Larry Love. All love. I got something here for you and me. Oh yeah, it's a medical marijuana. Whoa, whoa. I got something here for you and me. Oh yeah, it's a medical marijuana. Whoa, whoa, whoa.
Hello, everybody. Welcome to another edition of Medical Marijuana Radio. We're here once again with some great interviews, and this week we have Dr. Michelle Ross, and we are going to be speaking to her about her book. She has a CBD oil for health book, vitamin weed, and we're also going to talk about Kratom as medicine. And so let's get right to it. Here is Dr. Michelle Ross right after this.
This is the Medical Marijuana Radio Show with Larry Love. All love.
And we're back. And today I have Dr. Michelle Ross, and she's a neuroscientist with fibromyalgia who has been educating patients and healthcare professionals around the world on the power of alternative medicine as the founder of the Institute for Plant-Assisted Therapy. She's the author of several books, including CBD Oil for Health, Vitamin Weed, a 4-step plan to prevent and reverse endocannabinoid deficiency, Journal Yourself to Health, and Train Your Brain to Get Thin. Michelle is helping women heal chronic pain with CBD, cannabis, kratom, and mushrooms. She also has a 30-day mushroom challenge going on at this time, which she'll tell us about in a little while. Welcome to Medical Marijuana Radio, Michelle.
Thank you for having me. I'm so excited to talk about my many, many passions for plant medicine.
Yes, and your passion to help women feel better. And of course, fibromyalgia, which you do suffer from, is so prominent in women. You know, when I was running a dispensary some years ago, that was one of the most common things that people were coming in to use cannabis for. So let's start off with cannabis and how it's helped your life and how you try to proliferate this to people to help them.
Yeah, of course. In my career, I actually started off learning about cannabis first. So I grew up in a very conservative family, conservative town. So cannabis was not legal in New Jersey where I grew up. I ended up learning about it as a medicine when I was working as a scientist in Texas, where again, it's still not legal. So it's sort of funny. I really spent most of my early career in places where it wasn't legal, but I started learning about the science about it when I was assigned a paper. And again, you know, because I was working for the government studying drugs and things like that, I couldn't really use it myself. But I really didn't need to because I wasn't really sick at that time. I get exposed to a lot of toxic chemicals and things like that in the lab. Some really nasty ones now. They're like, whoops, we shouldn't have let you work with that without your hands, you know, your gloves on and things like that. So some nasty stuff that did actually have some nerve damage and things like that as side effects. When I moved to California, it was funny. I moved there to work as a postdoc in Caltech in Pasadena, California. I ended up, you know, being exposed a little bit to the cannabis culture because California has had medical marijuana since 1996. And it's sort of like, it's so funny to go from, you know, where cannabis is taboo, it's something like, you know, like your bad ex-boyfriend smoked or something like that, you know, to a culture where it's everywhere. And it was very different to see dispensaries on the corner and things like that. I was like, wow, this is different. You know, I've learned about the science, I've published on cannabis, but now I'm actually seeing people use it in a like legal way. And it was interesting. Around that time, I started to get some health problems and things like that. And even then it was still like, well, I'm just not comfortable using cannabis or getting high and things like that. And it took me a while to really start to learn how to use it. I really, the first real entryway for me using it, besides like smoking up like 1 or 2 times in college, was me using topicals. And I actually had a severe nerve injury in my right hand and arm, and it still is horrible injury to this day. People don't realize it because, you know, when like you're sick, but you don't look sick, people think that there's nothing wrong with you, the invisible illness, right? So I actually had damage in my ulnar and radial nerve. And what that is nerves that go through, your thumb, through your wrist, all the way up to your neck. And if you have any damage or any constriction in those nerves at any point, no signal goes through. And so I woke up one day, like literally like, when you sleep on your arm or something funny. And it was sort of weird. I was like, okay, I've got pins and needles, shake this off. And I'm like, my hand won't shake anything off. It's actually like clawed up. Like it's weird. It hurts. I'm like, oh gosh. And it just, nothing would happen. Like my wrist wouldn't move. It was dead. Like literally my hand was like that for months.
It was like locked up in a cramp or something.
Super painful. Yeah. Cramped and everything like that. And, after like the first hour where it was like that, I was like, oh my God, like I need to see a doctor. Like something is very bad. Something is wrong. And they didn't know why it happened. They said, sometimes it happens. They're like, but also it could be a sign that you have some other kind of illness or something like that. Like, why are you so inflamed? And, they didn't really know what to do. I had gone through all these doctors, like neurologists and things like that. And they're like, yeah, we're just going to have to cut nerves and tie them together or something. Like it was bizarre. I was like, that's it. Like here I am in my 20s and like, that's the option, like cut off all my nerves and like try to glue them back together or something. I'm like, this is ridiculous. I'm a neuroscientist. I'm somebody who studies the brain and in the nervous system. And here I am having this thing happen in my nervous system and I can't even figure it out. Right. And so I went through all the alternative medicines and things like that. Like I tried like electroacupuncture, things like that, like to try to wake up like the hand and things like that. It was hilarious. But it wasn't until I actually started consuming cannabis products that things changed. So it's like literally I tried everything under the sun. And then I started using cannabis. Like I used the topical. And what happened was I had nerve inflammation. And again, like they didn't know where anything was wrong, right? And they just knew that there was no signal coming through. What was really interesting was I started putting the cannabis cream to like on my arm and my hands. I'm like, something's got to happen. It stops inflammation and things like that, rubbing it in and things like that. And I did actually start to see some relief, again, like not really signal or anything like that. I started consuming just, again, like edibles and things like that. I'm not a big smoker. And for me, it was just like, eating gummies, going to sleep, like praying that somehow like the inflammation in my body would go down, because that was my thing. I thought, hey, if it's a nerve signal problem and the nerves aren't working, it's probably because they're not getting nutrients and like there's something wrong, there's something blocking it, right? And inflammation can do that. Also muscle constriction can do that, right? Like if things are too tight and they're pressing on nerves and things like that. And so I wasn't clearly like sure what was going on, but I was using the topicals, I was using the edibles, and then I had actually a massage therapist identify where the cold spot was in my arm, and
Really?
she massaged this area after I put cannabis cream on it for 4 hours.
Wow. And
Like,
was it
working.
was it a THC a topical or like a
Yes.
both?
So I use till this day straight THC creams. For me, I still have very severe nerve pain, and that was just the start, of course. Like that was the beginning of unfortunately a health spiral, really, because again, I've been exposed to so many different toxins and things like that over my life, and I also have the genetics of somebody who doesn't deal with toxins very well. Like I got hit with a double whammy, but for me, unfortunately, CBD creams don't really do too much for reducing the inflammation. I really need something much stronger. I know some people use 1-to-1 ratios of CBD and THC products, but for me, just straight THC creams are the way to go. I prefer also like a little peppermint oil, things like that. I make some myself now, obviously, because I use so much. It's hilarious. Like the amount of cannabis cream I use on my different body parts, like I would go through hundreds of dollars, like a week in that cream. So of course I make my own, and it's also safer too, knowing that I'm very sensitive to some of the toxins that are in the things. And again, you think that products in the dispensary are medical, and you're like, oh, look at all these preservatives and all this crap that's in there, right? It's like, well, your body's absorbing the cannabis. It's also absorbing some of these chemicals. So for me, because I'm very sensitive to chemicals, I have to make a lot of my own stuff. But like the moral of the story is cannabis was the only thing that actually woke my arm up. And again, it was slow. It was like, oh my God, I can feel my pinky. But after not feeling your pinky for 3 months, it was amazing. And it was actually about 2 weeks after really realizing where that pinched part was and really focusing on that. And to this day, I still massage that area. And now it's actually another area on the other arm is also like the same problem.
So you have to use maintenance.
So it's been years. It's funny since that happened. Goodness, that was like 2013 or 14 or something. Like it's
Mm-hmm.
been years. But eventually I was diagnosed with fibromyalgia. They thought I had MS. They thought I had all these different things, right? Like, and it's still like, I think actually I don't fit into like any of those buckets. Like I have a whole bunch of different problems, and it might, again, be just toxin exposure. But for me, cannabis is one of the things that really keeps my body healthy, keeps me out of pain. And for fibromyalgia specifically, I mean, it's one of the
So,
best out there.
so let's talk about fibromyalgia because
Yeah.
again, that's so prominent in women. I mean, weather affects them, you
Hmm.
know, and gives them more pain if certain weather. They can tell when storms are coming. People with fibromyalgia. So what is your routine for feeling better when you have fibromyalgia?
Well, I mean, I have fibromyalgia every day. Unfortunately, it's not a disease that goes away. I wish it was, right? So my goal and the goal with every patient is like less bad days. And the number one thing to have less flare-ups of the pain, right? And to have a more manageable level of like background pain is really to manage your stress. And so there are things that I do to reduce pain. There's things that I do to improve sleep. There's things that I do to manage stress. And so that's the number one key thing. So for me, if it's smoking, a cannabis strain that helps me relax at night and helps me get to sleep better, like that's a huge thing because less stress equals less pain flare.
Hmm.
But specifically for the pain, I do have really, really high levels of nerve pain and muscle pain in my feet and my legs. And also again, sort of again that old pain, but like there's new fibro pain there too in my arms and my hands. I'm also a writer, so I overuse
Hmm.
my hands, so I use topicals daily. You have to reapply them every couple of hours. They don't work from morning till night, but it's definitely something that is in my regimen. I try to use Epsom salts infused with THC. Also, I found that CBD is just, again, doesn't work for me topically.
Hmm.
So I use that. In terms of cannabis use during the day, I am hilariously very sensitive to THC during the day. And one of the things I found out along my health journey when I was in the hospital was that half my liver is a benign tumor. And so sometimes you have people ask, so like, why am I really sensitive to cannabis? Or why do I eat an edible and I don't have any response? Like everyone has a different response to cannabis.
Right.
And I was so like, I was embarrassed for years because here I am, teaching people about cannabis, how to use things. And I'll be like, if I take one puff on your strain, I'm either going to be really weird or go to sleep. Like I can't use it during the day. I can only use it if I'm going to relax and then like fall asleep
Hmm.
like 10 minutes later. And for me, that was one of the answers where, okay, like this makes sense that my body's not metabolizing THC in a normal way, at least while I'm awake. And so for me, it wasn't right for me to, puff on a vape pen or something like that
Hmm.
during the day. I microdose. So for me, I do end up, being able to take very small doses of THC during the
Hmm.
day, and it keeps me focused and energized. So
Before we talk about the microdosing and
yeah.
vitamin weed, back to fibromyalgia. Is it properly diagnosed?
Oh my goodness, that is the big thing there. So
Yeah.
fibromyalgia is actually really, really hard to get a diagnosis. People don't even know like what the steps are, and I think the medical experts don't even agree. So for a while, it was you had to have a certain amount of these tender points on your body. You're like, ow, when you touch your hip or something, it hurts, right? If somebody like points to these weird spots on your body, if they press it and it hurts, you have fibromyalgia. And what they
Hmm.
found was that not everyone with the disease actually, was classified under that. Now there's like a blood test for it, but only like 60% of people with fibromyalgia are positive for it. But so
What
it's
does
like
it?
it's hard.
What does the blood test show?
Yeah, it's looking for a certain
Enzyme or
protein
something?
in the blood.
Okay.
Yeah, and so some people have it, some people don't. It's very similar to like how there are tests that are supposed to identify like for lupus, for this or that. So
Hmm.
they're still working on it. It's like an FMA test they call it, but they're still like it's still. I would say in like beta form, but in terms of, how do you know that you have fibromyalgia? It's usually by ruling out that you don't have other diseases. So a lot of people go through things like MRIs to say, okay, do you have MS? Because some of the symptoms are very similar. Also lupus.
Hmm.
Lupus is an autoimmune disease, and actually a lot of people with fibromyalgia have it, but it is in fact a different disease. It has
Uh-huh.
different symptoms, but it can also a lot of these diseases, sort of dance together. They're
Hmm.
comorbid. So for fibromyalgia, for me, it was like, it took probably like 3 years to really come up with that that answer. And it's still like, well, what else do you have? And so like, do you have Lyme's disease? Do you have lupus? Do you have, I have migraines with aura, without the pain. It's really weird. Like my scan showed I get auras and I thought I was having strokes. And they're like, yeah, you just have auras and you don't have any pain. And I'm like, cool, just add that on to the other diagnosis, right?
I lived with a woman that had auras that sometimes would be a precursor to seizures. And it's a very strange situation, hard to understand it. For a partner of somebody, it's just devastating to be with someone who's going through an aura or a seizure. Just before we go to vitamin weed, I just wanted you mentioned multiple sclerosis as as something that cannabis can help, and of course Montel has been talking about that for years. So is there a regimen that you know of for people with multiple sclerosis? I have a very close friend, a few close friends that are dealing with that.
Yeah, and again, I think everyone's regimen is very personalized, but I think it's one of those things where as soon as you get diagnosed, the more cannabis you can get in you, the better. Also, CBD can be very valuable as well in protecting the optic nerve and reducing damage to that. Vision problems is one of the major things that happens with MS. And of course, sometimes you can deal with pain and all these other, symptoms, right? But losing your vision can be really devastating. And so I think that's one of the fastest things that you can do to really, protect your vision and everything is to start using THC, to start using CBD. I think that they both really do have value. Some people obviously prefer THC products for better pain relief and for better muscle spasm relief. I do believe that topicals are very, very helpful too for helping with muscle spasms.
Right.
So
So use the topical liberally, right? Get it into the muscles and so forth. So all right, so for the last 80 something years, our endocannabinoid system has been deficient. It hasn't been stimulated because of prohibition. So you have a book that came out many years ago called Vitamin Weed, and it's about microdosing. So let's get into that and what is microdosing? And obviously it's going to be different for everyone because our bodies react differently to this plant. So tell us about vitamin weed.
Well, vitamin weed actually isn't about microdosing. It's really about the act of using either cannabis or other plants that stimulate the endocannabinoid system every single day. And again, it hits on that fact that other cultures actually consume, phytocannabinoids or plant-based cannabinoids at a much higher rate than we do, because again, the Western American sad diet and lifestyle is in fact very, very sad. So, it's really about finding the things in your diet or your lifestyle that are harming your endocannabinoid system, adding back things that are helpful for it, and then doing stress management. I think the thing that people don't realize when they use cannabis, right? Well, cannabis can reduce stress, but like some people are, they'll use a little bit of CBD oil and wonder why like all their health problems didn't go away. Well, if you're not sleeping right, you're not eating right, and you're very stressed out, the stress is actually what really hurts your endocannabinoid system, and it can really make some of the treatments that you're trying to do. You're buying cannabis to, help your body or help your illness, but you're super stressed out. And so your cannabinoid receptors aren't responding in the right way. Or, you might be altering how the enzymes that break down CBD or THC or anandamide or things like that are working in your body. And so it's really, it was one of the first holistic guides to really incorporating cannabis into your system. And it's like, you have to do stress management, you have to have sleep, you have to have sex, you have to have all the good things there. And cannabis is just one of the pieces in really being healthy. But the other part about the book that I really liked, when I put it out there, it did actually really go into some of the deep science. It wasn't just like a fluff book. There's a lot of fluff books out there, as a scientist, as a scientist, right? It's really important to help convince doctors and patients that there is an endocannabinoid system that some people, it's not working right in. And here are the reasons for that, right? Like if you have Crohn's disease, for example, we know that there are mutations in the cannabinoid receptors, CB1 and CB2. And we know that if there's a mutation in your receptor, it can either make it work better or work worse. And most of the mutations we've seen that they work worse. So in Crohn's disease, which is very responsive to cannabis, we know, again, dysfunctional cannabinoid receptors need more cannabis. So eat more cannabis, treat Crohn's, have less pain and have less inflammation and things like that. We're starting to find out that like diseases like fibromyalgia have this endocannabinoid deficiency. So it was really like telling the story of why your endocannabinoid system is so important, that cannabis should be a first, medicine, not like the medicine of last resort. And it was like that story. It was really important to come out with that, because again, we were just seeing, books on like, okay, here's how to smoke weed, here's how to roll a joint. And I was like, here's why this should be part of the American medical system.
Right. And of course, dosage is the important thing, okay? Because, first of all, if someone is new to cannabis and they try an edible for the first time, and if it's not really small, they could have a bad time and never go back to this wonderful medicine that will really help them. So educating physicians, educating people at the dispensaries is so important, and it's not getting done enough. It's done in some areas, but most of the time you just hear terrible stories about going in to try to get information from bud tenders. But educating physicians, are you involved in that?
Yeah, I've done a lot of education at different conferences. I've worked with doctors. I've also created some educational courses at the Institute of Plant Assisted Therapy for doctors and other clinicians. Again, there's not just doctors; it's the nurses, it's the nurse practitioners, our yoga instructors. Like, there's so many wellness professionals, right? One of the things that I found was the biggest misunderstanding in the field was how to deal with moms who use cannabis. And we're not just talking about, somebody who has a little kid and they want to smoke, weed on the weekend or something like that. People didn't understand, what does cannabis do to fertility? What does it do when you're pregnant? What does it do when you have, like, you're in labor? What does it do when you're breastfeeding? Is it good for postpartum depression? Like, no one knew all these things. And there was a lot of like blanket misinformation on it. If you're a woman of childbearing age, don't use cannabis. And you're like, well, that's silly. Well, but I would exclude everyone.
It's an important issue. I did a show many years ago with a woman, Paige something, from South Africa, who I think now lives in Canada, and she was proliferating cannabis in South Africa, and she was involved with pregnancies and so forth, and people can get in trouble, women, when they have a baby and they get their blood tested, and naturally our women's bodies produce some cannabinoids, and they've gotten in trouble for that. So tell us why cannabis is good for pregnant women, and there's studies from Jamaica and other places. So tell us what you know about that, if you would, because it's an important issue.
Yeah. So, I would say that during pregnancy, right, the ideal is that you're healthy, you're glowing, like you don't need anything, you're just carrying this baby and like everything is great. But the reality is that many women had pre-existing conditions before they conceived, right? So think about if you're a chronic pain patient, you're on opioids, right? You find out you're pregnant, maybe it was unplanned pregnancy, and you go, is it better for me to be taking Oxycontin during my pregnancy, or is there something that might be safer for my baby? And these are the questions that mothers have, and the guilt and the shame they feel. They're like, am I going to create birth defects or have my baby come out addicted to opioids, or am I going to have them be addicted to cannabis, and having these conversations about what really actually happens, that there is no fetal cannabis syndrome. There's a fetal alcohol syndrome. There is neonatal opioid, withdrawal and syndromes and things like that. There's even syndromes with women that take antidepressants. So when we talk about taking cannabis during pregnancy, it always should be framed with, harm reduction. So is there a dose of cannabis or CBD that is safer, and what is the safest route of administration for a mother to take this, and why would they take this? Okay, reasons might be pain relief. Again, being a chronic pain patient before, some women have seizure disorders and they're worried about the effects of their prescription seizure medication on brain development, and those are very real things.
Those are very strong medications, seizure medication, Neurontin, all that stuff. So I can see that it would be devastating to a fetus and a newborn child. So go ahead, please.
Yeah. So the main reason, though, that women do turn to cannabis, especially if they haven't used it before, is for nausea and vomiting. And so, it's not a minor thing. A lot of women will even try the prescription drugs like Zofran and things like that to stop it, and they can't keep food down. And the thing is, if the mother can't get nutrition, the baby is going to suffer. And the woman, the mom is suffering too. Like, sometimes we forget, we focus so much on the baby that we forget, like, there's a human that's carrying the baby, and they're important too, right? Their lives are important. their quality of life, and we really need to take care of them. And I think that cannabis, even small amounts, might be taking a little bit of tincture under the tongue, even just like a puff, right? Like a puff of cannabis is not going to cause brain damage. It's not going to cause anything, but if it stops you from vomiting the whole day, that is actually a very effective way to treat that. And a lot of women have used that. And I want to frame this with, we do actually know what THC does in women. Marinol is again, just the THC part of the cannabis plant, and is available as a prescription.
Synthetic.
Yeah, synthetic. Yeah.
Okay.
Yeah. But, for most people, they say, well, there's no data on this. We don't study pregnant women. There are doctors that prescribe Marinol to pregnant women, and specifically for this reason, and it's the one prescription drug that works for them. So I think that the plant itself is actually much safer. It has less side effects than Marinol.
What do you think about using the navel as a point of topical?
I don't have that much experience with that. I do know that is something that is used in Ayurvedic medicine.
Right.
Now, in terms of pregnant women and cannabis, right? Of course, that would be closer to the umbilical cord and the placenta and things like that. So I think if they're trying to treat nausea, we don't want to be treating the baby. So
Right.
we'd rather eat it orally instead
Good
of
point.
that. Yeah.
Really great point. So what else about cannabis before we move over to psilocybin, which I know nothing about, and I think it would be good for you to explain that to someone who doesn't have knowledge, because that's most of the population. So anything else about cannabis before we move?
I would just say, as a brain scientist who now uses cannabis every day, just open your mind, do some research. And then if you're going to talk to a doctor, nurse, et cetera, expert that actually knows about it. Because again, somebody who doesn't know will tell you no.
Right. Well, let's just make this point right now. They've been telling us for many, many years, like 50 or 60, that we're burning our brain cells. Okay. And I've been using cannabis for 53 years next month. Okay. So, I think I have a few brain cells left, but what we found out, and I say we, I mean scientists like you, is that cannabis actually creates neurogenesis, which means what?
The birth of new brain cells.
Okay, very good. So that is the opposite of what we've all thought, and so actually, it's becoming, hopefully in the future, a great treatment for Alzheimer's and dementia and so forth. I know that, at least with my experience with taking care of my 80-something-year-old mom a few years ago, who was diagnosed with mild cognitive impairment. She was in the medical cannabis program here in New Mexico, and I started her very well. First of all, she had smoked cannabis because she was married to a jazz musician for 50 years. So it was not new to her. But I introduced her to very small, like 1 milligram, and watched her and built her up to like 35 a day. And it definitely took the edge off the, sometimes agitation is involved with dementia and Alzheimer's. So I think there's going to hopefully be a protocol in a few years to help people with this and rebuild their brain cells. So now let's talk about psilocybin and mushrooms. I only tried mushrooms once with psilocybin back in the 80s, and probably the wrong dosage or something. I got nauseous and didn't experience anything other than that. So I'm a newbie. So tell me, now that Denver and some other cities and places are legalizing or decriminalizing this, what's the future, and how is that helping you and other people right now?
Sure. So psilocybin mushrooms, of course, are a little bit different than the mushrooms that are available on your pizza, or even, like the medicinal or functional mushrooms like reishi and things like that. They're specific hallucinogenic mushrooms, and you can take them in low doses, which we call microdosing. Very similar to like microdosing cannabis. You don't want to get high, but you want benefits like creativity or focus, or maybe even just a little bit of the depression lift. For some people, microdosing is great. They see results. For other people, they say, hey, it felt like more like placebo. I didn't really feel anything. And they find more benefits from, I would say, what we call like intermittent, like macrodosing. So macrodosing is taking a dose that's enough to have those hallucinations, to, rewire your brain. So for me, I've done microdosing in the past. I have a lot of pain and things like that. So again, for me, I actually find a lot more benefit from like once every 2 weeks or once every month, taking a larger dose, anywhere between 3 and 5 grams of mushrooms, and, setting aside some time on the weekend to really relax, reset my system, rewire my brain. What's nice about psilocybin is it activates your serotonin receptors. And we know that in many diseases, including fibromyalgia, depression, PTSD, things like that, there's an imbalance in serotonin. So a lot of mental health disorders and chronic pain disorders find relief in these large doses of serotonin, even if it's just simply acting like an antidepressant.
Hmm.
But then, an antidepressant doesn't make you hallucinate, right? And so it's really interesting because much like cannabis, sometimes the healing is in that psychoactivity. The healing is in changing your perspective. The healing is going through things in your brain and looking at it in a new perspective. You will hallucinate a little bit. You will go on a trip, when people think about like acid or mushrooms or something like that, like you will see visuals, you will hear things.
Well,
And how you heal is like dependent on how you go into that experience.
so is the dosage for someone tied to their weight and their body and so forth? So how do you calculate what's a micro and what's a macro, and how do you describe what a hallucination is for those who have never hallucinated?
Yeah, and I mean, I hate to say hallucinated because it sounds like you need to go to like the loony bin or something like that, right? It's again, dosing is how you control your experience with this. And again, you can have very different experiences with it, with your eyes open, your eyes closed, or things like that. So for beginners, right, when we're talking about like microdoses, we're talking about like you're eating like a little eighth of a cap of a tiny mushroom. Like it's not a lot. Some people grind up the mushrooms and weigh them and put them in capsules to be able to figure that out. But like a larger dose, again, if you have a scale, you can figure out how much you're using, because you can't just look at it and be like, oh, I took one mushroom, it's going to be the same amount. It's not.
Right. So that's part of my question is, scientifically in a lab, let's say, how is psilocybin measured in X amount of mushrooms? I mean, could 1 gram of mushroom have too much psilocybin in it, depending upon how it was grown, where it was grown, and all that stuff? Enlighten me about that.
Sure. So psilocybin is just one of the ingredients in magic mushrooms. So there are actually other chemicals that may actually cause like an entourage effect of healing, and also hallucinogenic effects. So there's many species of psilocybin containing mushrooms. They're not just one, right?
Hmm.
And so each of them has a slightly different profile and slightly different experiences. Like you might take the same amount of grams of one mushroom and have a much more intense or much more visual experience, while another mushroom might be like more audio, or when you close your eyes you see like almost like a laser show or something. Like they all have slightly different effects. Again, some make people a little bit more nauseous than others. And so when you are sort of like an experienced connoisseur of magic mushrooms, you can really say, hey, I really like this type of mushroom, and I really would want to avoid this one. Unfortunately, in the United States, again, since it's not really super legal, it's not like cannabis where we can know, okay, I love this strain, I hate this strain. Sort of how we operate in the United States is like whatever mushrooms you get. But that, people in other countries where it is legal sort of know how to navigate and which ones they really like and which ones they don't.
So what would you advise for a first-time person who, maybe is a member of your website and has read some of your books and so forth, but who wants to try this? Because I've read that even one dose of psilocybin can help someone's PTSD for a long time. Just one dose. So tell me how that's possible, and how would a first-time person get started?
Yeah. So again, the first thing to remember is that even though it's natural, right? Mushrooms come from the ground, we eat them, that they're not appropriate for everyone. So the first thing would be safety, right? Are you on a medication that it might not be safe even to microdose with? And so if you're on an antidepressant that already increases your serotonin levels, especially MAO inhibitors and things like that, you may end up with a syndrome called serotonin syndrome, where you have too much serotonin and can actually cause some really bad side effects. So that's something to think about. A lot of times depressed people are like, oh, I'm going to go take mushrooms. And I'm like, wait, what are you on? Like, let's talk about that first, because you could get sick. Secondly, if it's a new user experience or things like that, also, try not to do other drugs with the mushrooms. Sometimes people do them recreationally, sometimes people do them like medically, but it's just good to sort of, again, be able to screen out what was my response to this. Set and setting. You want to be somewhere where you feel safe, and you want to do it with people who you feel safe with. Sometimes people want to do it by themselves for that first time. You can go, in a quiet place, pick out a nice, like cool, like music playlist, close your eyes, listen to music, relax. If you're going to take a larger dose with microdosing, and again, you're not really going to feel it. So you don't really have to worry about like set and setting. Just if you are going to microdose and you think that you're taking a small dose, and you're not like grinding it up and weighing it and being very scientific about it, you're just like, oh, I'll just eat like part of this cap. You may end up with too much psilocybin, because the psilocybin isn't always equally distributed across the entire plant. So like a gummy, think about a THC gummy that, back in the day when they weren't really mixed up well. And it's like, well, all the THC was here, and you took about the little piece and you got way more than you thought. So just do it on the weekends when you know that you don't have to go to work.
Right. So how do you do it? Do you chop it up and mix it into a milkshake or a drink? How do you just, can you cook it? Does cooking it and putting heat to it change what's in it?
Yeah, in terms of how people usually do it, you can put it in chocolates and things like that. Of course, like super high heat is going to disrupt the molecule. Just like, if you heat up THC in cannabis too much, it does turn into other things. But for the most part, you can put mushrooms in chocolate. You can make teas with it. That's actually a really gentle way to do it. And there are a lot of books out there. I haven't read a book on magic mushrooms, but there are a lot of great books out there, like the Psilocybin Companion, like that are great for telling like first timers, hey, this is how you make a mushroom tea. It's like sipping on tea is so simple. It doesn't seem scary. It doesn't seem like you're taking drugs. But like the nice part about this is whatever way you do it is right for you. And so like for me, I will normally just, again, because I'm doing, and microdosing or something like on a day that I don't have to worry or it might impact, my work or something like that. I try to stick it to weekends if I do that. And then again, higher doses on the weekends as well. But like for me, I just eyeball things because I'm used to weighing out things. Like I'm a very experienced, but like for a newbie, I would say, again, kitchen scale is helpful, to know how much you're using. A lot of people use the same weed grinder that you use to grind up your cannabis. You can also use to grind up psilocybin if you want to put it in a capsule or things like that. Like again, small amounts, if you're looking at like, 0.25 grams or something like that, something very small, you need to figure out what your threshold dose is. If I take this amount, I'm going to feel high. So I need to always use less than that. It's going to be a little bit different for everyone because again, our brain chemistry is different.
What about the next time you get that same species of mushroom? It's not going to be the same, right? So I mean, it's sort of always an experiment at this point.
For microdosing, it really is sort of like you have the same experience. So with microdosing, you're not really supposed to be taking it every day. It also can build up in your heart valves a little bit. A lot of people don't realize that. So it's good to do, like one day on and like 2 or 3 days off. So that way you're never getting, again, like super sensitized to it where you need to like increase your dose or something like that. So you're taking small amounts, your body's not becoming intolerant to it. So you can use the same capsules, like, again, like one day on and then like 2 or 3 days off. And so you're not using a lot, you're using it very sparingly. But if you are going to do it for macrodoses and things like that, again, it's not like, okay, well, today I used 5 and then every week that I do it, I use 5 and now I have to use 10 and 15. Like, no, like you don't really become having these escalated doses of it because you're not using it daily. So again, your brain is like, it's very different than like say other things like opioids, right? Opioids, we get tolerant to really fast. And that's why people have to keep increasing their doses. And it's like less safe and less safe with the psilocybin containing mushrooms. Again, because there are some, there are side effects to anything, even natural things. It's best to, again, use them. I would say not daily and try to use lower doses than you think that you might need, especially if you're new to this.
What happens to the body when what we just mentioned a few minutes ago, that one dose could help a PTSD person, that's suffering from that for like a year? What is it doing to our brain that fixes that sort of, or masks it, or I don't know how to explain that. You would be able to explain better than I.
Yeah, I mean, it's definitely changing what we call the default network. And so your brain always has like this background piece of it always running. And so when you're on psilocybin, it's actually turning some things off. It's turning on some things. It's helping rewire brain pathways. And with PTSD, depression, anxiety, all these different things, there's parts of the brain that are too active and there's parts of the brain that are underactive. And so, for example, your fear area, your amygdala, right? That's the part that if you are suffering from a lot of trauma, right? It's always like we're, spilling out fear and anxiety and I can't say the word today, hypervigilance.
Hypervigilance. That's a good one.
Yes. Yeah. And so, it's really important to be able to tell those brain areas, relax, calm down. There's no more fear. There's nothing to worry about. Right. And again, some of these things that are happening, you're actually mentally processing these things because you're seeing like a little movie in your head. Right. And it's so interesting too, because everyone sees different things, right? Some people see things from their childhood. Some people just see random things, like it's interesting, again, based on what you're taking, how much you're using it, where you are, and what's going on in your head at that time. Like if you had the intention to heal, you might see healing, go through that healing journey.
Right.
You might go through something that's very uncomfortable, but at the end you actually feel better about it. So again, it's like bad trip, good trip, all these things that are happening, but like your brain is highly active and it is rewiring things. And the goal, if you do go through healing, again, the trip itself with mushrooms isn't where like all the healing goes. Ideally, you would be going through a session, whether it's yourself in a journal or a workbook or something, or with a professional doing integration and really understanding, okay, I went on this weird journey. I confronted my fears or something like that. Like, how do I feel about this? Or, what did I learn from this trip? And how am I going to use that in my life? Right. Because we can go through great things. We can go through uncomfortable things. But again, the goal is to feel, less traumatized, more confident, let go of baggage. Right. Again, sometimes things pop up in our mind. Like our mind has so many memories. Sometimes we suppress memories too. Like we need to go reprocess them.
That's what's so amazing about our brains, is that it's a computer. I can't even, to recall something that happened to you 50, 60 years ago. It's just amazing. And of course, Elon Musk from Tesla thinks that he's going to be able to record people's brains someday. I don't put it past him. I really don't. I think
it's possible.
Yeah. So again, with the what we just said about helping people get better, I understand that there's also an end of life use for psychedelics. And can you tell me about that? Have you read anything about it? Has it been with anybody that has experienced it? How long does it take to actually come on, to feel psilocybin when you take it? And go ahead.
Yeah. Sure. So some of these first studies happen with an organization that you probably know very well, MAPS. And so they were funded, primarily they started with MDMA, which is another entheogen, although a synthetic one. They've also done psilocybin mushrooms. And these were given to people that had a terminal diagnosis of cancer. And of course, that can be very, very upsetting, knowing that, it's your time here is over, how getting over that grief. We know that if somebody is more accepting of their diagnosis and more positive and is actually like, doing everything that they want to do before they die and very positive, they're actually going to live longer than if they're just traumatized by that diagnosis. And so, to be able to help them with that anxiety and grief and things like that, the psilocybin actually really helps them have like sort of a spiritual experience. A lot of them felt like they were closer to God, or that they were okay with this and they were like moving on to something okay. It wasn't the end. And that was really, really key, right? Knowing, maybe if you weren't a religious person and you went through this, and maybe this wasn't a typical like Christian type of religious experience or whatever you thought, but you had a very spiritual experience and you were okay with the end of life journey, people come out of it very positive. Now, I do want to frame something here, because this is something that's come up in the studies, is that not everyone that takes mushrooms, say like, then has cancer, not 100% of people had these amazing experiences. Some of them had they didn't feel like anything. They were just like, oh, I just hallucinated a little. It wasn't meaningful, right? So not 100% of people went through these experiences and had these like, again, life-changing, enlightening, beautiful transformations and acceptances. Some of them people went through them and nothing happened. And that's where, I want to frame it is that we have to manage our expectations too with some of, cannabis and magic mushrooms and all these other things, because just like any other pharmaceutical, right? With like anxiety drugs, like it's a winner if it's like 20% of the people responded, right? Like, so there are some people that don't respond to some of these substances, but again, it's a game changer for those that it does. So just to frame it, it's not 100% of people are, come out with like, unicorns and rainbows, but it is so meaningful to be able to give somebody that peace at the end of their life and that dignity. And I think that is something that's missing from this process. I think that we spend so much time trying to extend people's lives and, they're hurting, they're in pain with cancer and things like that. And instead helping them make that transition dignified and peaceful is like, that's all you want. And I think that it shouldn't be just, obviously regulated to people with a terminal diagnosis of cancer. There's so many other illnesses, right, that are traumatizing to have, that are hard to have. Anyone with a chronic illness struggles with, having to wake up in pain, having to go to sleep in pain, being able to reframe that in a positive manner. Like for me, that's why I take psilocybin mushrooms. It helps me escape from the pain in a little way, again, a much healthier way than say taking opioids or something would. But it also helps me, come to terms and be okay with this is my life.
Sure.
And I think that's really key. So I hope that it expands to everyone has access to this.
Right. Well, talking about pain, we can move right into Kratom, or Kratom, as some people call it. I've had no experience with it personally, except for that maybe about 10 years ago, I knew a couple of people that were using it, and they were actually snorting it. I don't know if that's really the right thing to do,
Oh,
but
goodness.
I looked at it under a microscope, and it did not look like anything. It looked like wood chips to me. So, have you ever looked at it under a microscope?
I have not. I mean, it's supposed to be the ground leaf of the kratom plant, which is related to the coffee plant. So, I mean, I would assume that would look like, I don't know.
It
Well, it wouldn't
didn't.
look like cannabis. It would look more like
No,
matcha green tea powder.
it didn't look good. So anyway, and I sort of judged my acceptance or not of kratom by the way these people were acting out and so forth, and it wasn't pleasant. So tell me why actually it can be used for pain and getting off of, I believe, opioids as well, right?
Yeah, so I think a lot of things have changed in the kratom industry, maybe since you had that unique experience. So the quality of products, lab testing, safety, and everything that has gone up. So this kratom is a cousin of the coffee tree. It's grown in very tropical areas like Indonesia and the Philippines and things like
Thailand.
that. Yeah.
Yep.
And so it's not really grown in the US. So most of it's imported. And of course, your product, as we know with cannabis, is only as safe as it's grown. So, being pesticide free, not being grown on areas where there's like heavy metals and things like that, it's super important for the product to be lab tested. So before kratom isn't really like super approved for human use. And it's sort of one of those things where people are hoping it was like grandfathered in because it's been used in indigenous medicine, sort of like how CBD oil, we're like, well, there's hemp sort of in the pipeline here, but it's very much a gray area. However, in the United States, the American Kratom Association actually passed regulations in several states, including the state that I live in, Nevada. They passed the Kratom Consumer Protection Act. And so they require things like nutrition labeling on the back of packages. So you need to know exactly what's in there, how potent the different main ingredients are. So in cannabis, right, the active ingredient is THC, and then they'll list CBD and maybe some of the other cannabinoids or terpenes in it. For kratom, we're looking at these alkaloids that activate the opioid system. So mitragynine, 7-OH or 7-hydroxymitragynine. And there's other minor alkaloids that we're learning about, and they're listed in my book, Kratom as Medicine. But, lab testing has to catch up with all the science that's happening right now. But those are the two main important ones, because you need to know that your product has normal levels of these ingredients so that you don't get too, like you're not taking too much medicine, right? You need to know, like when you're taking a morphine pill, what the milligrams of morphine are in it, right? So that was a huge improvement. Also requiring lab testing. Are there heavy metals in it? Is there bacteria in it? Because this is powder, right? Any tea powder could get bacteria on it if it's mispackaged or things like that, right? Again, potency, has this been sitting around for 8 years and it no longer, it's inactive, right? Or is it actually active ingredients in there? So it's been super safe. And I would still say that there are some bad actors out there. But the medicine has completely changed. And for me, I had a similar experience 4 years ago when I was in pain, right? I was in a wheelchair and somebody's like, you should try this. And I'm like, I tried these random pills somebody had sent me. I went to the emergency room and like literally I didn't use it for a year and a half afterwards because I was like, it nearly killed me. Like,
Wow.
what is this? Turns out I was allergic with food coloring that was in the capsules that wasn't listed on the back. So that was like the scary thing, right? Like that's a similar experience. Does this work? Is this safe? Like people were like, I threw up everywhere. And you're like, yeah, that's not the Kratom. Sometimes they even had back in the day, like ingredients like spice, which is synthetic marijuana in there. And you're like,
wait.
I hate that term. I hate that term.
Synthetic, that was not synthetic marijuana.
No, it is not.
Marinol,
I know, it's not Marinol.
Jabinol, those are synthetics.
Yeah.
So does Kratom, have a psychoactive effect?
Okay, so it does. So Kratom, again, just like with any of these plant medicines we're talking about, it's all about dosing. So opioids obviously can have many different effects. At low doses, Kratom and its active ingredients can increase energy. They can increase focus. At medium doses, they can start to have pain relieving effects, but still be very energizing, which is why they're helpful for people with chronic pain conditions. You're like,
but energizing.
Yeah, it's like a sativa with a little bit of the indica pain relief, right?
Okay.
So it's very helpful for pain. At larger doses, it's very pain relieving, but also sleep inducing. So some people with sleep issues will take it at night, especially if they have pain. There's also different strains. So like, it's so similar to cannabis because, we don't have thousands and thousands of strains, but we have red leaf strains, we have white leaf strains, green leaf strains, mixes of strains.
Are those strains or cultivars in the Kratom world? That's very specific.
And I think it's really how they process the leaf, and it's also the origin. So it's probably more cultivar.
Okay. All right. Before we go, and I want you to tell us where you can get your books and so forth. But before we do that, I want to circle back to cannabis and cannabis hyperemesis syndrome. What do you believe it is? I have my own opinions.
Yeah, it's a very controversial topic. And for listeners, I mean, that's a syndrome where it's supposed to be that somebody who has consumed high amounts of cannabis for many years, the average onset in the literature was like, hey, somebody using high doses for 16 years suddenly wakes up and finds that they can't consume cannabis anymore. They have sweats or like in withdrawal. And if they take more cannabis, they get sicker. And like a lot of it's associated with taking hot baths and things like that for relief. And I do know some people in the industry that have had this syndrome and it's horrible. They can't even take CBD. Like any cannabinoid makes them sick. And now like other substances that like are almost like related cause similar issues. So it is real. I think that the medical industry was really excited about it because they're like, now we found a reason why we shouldn't legalize cannabis because everyone will get this. It's not true.
No,
but
very small percentage of people.
Very small. And I think that there is some misdiagnosis. I'm not sure why we're seeing, again, education always leads to more diagnoses, but I also know that I had a doctor diagnose me with it when I went to the ER. And hilarious, this is my story of how I got this diagnosis. It had nothing to do with my cannabis use. Literally, I have a bunch of health issues, including I get ovarian cysts. So like things will burst and hurt and I have to go to the ER and like get like blood drained. Like it's like horrible. But I went there and I was in horrible pain and the doctor kept asking me, what are you on? Your doctor must have prescribed you something. And I go, I don't really want to answer that question. And then finally I was like, yeah, I take edibles at night for pain for my fibromyalgia. Okay. Like that has nothing to do with my ovarian cysts. Like just treat me. And the doctor was like, she's high and all of her pain is caused because she has the hyperemesis syndrome. And I was like, that doesn't even make sense. That has nothing to do with this.
Right.
I haven't taken cannabis today. Like, like I'm here to get some medical services done and like some diagnostics. And they just write that on your file. And it's really hard to get that unwritten. And it's a sort of a stigmatizing diagnosis. I don't have it.
Exactly.
I never have it.
Right. I know someone that does have it and he doesn't use cannabis for 2 or 3 weeks and then he's fine for another couple of years. He gets it every few years. So can we do 1 minute on cannabis tolerance? What should people do when they've taken edibles or oil and so forth and they're not getting where they need to be? Do you know how long they should take a little break or to get back to what they're used to?
So tolerance breaks with cannabis are much shorter than they are with other, substances like opioids. So some people do see, even like a day and a half, 2 days break. Some people need a week's break. But I would say that if you have been using high amounts of cannabis, that you can experience withdrawal effects like insomnia, irritability, nausea, and things like that. And if you're a pain patient or something, you're taking it, you're going to feel your pain again. So in order to buffer those potentially not great side effects, CBD oil can be used to help with any types of withdrawal symptoms or with pain. It's not going to affect that tolerance because, again, CBD is acting as a different way than THC. So it will help reset the receptors a little bit faster.
And CBD also if you're having a bad edible trip?
CBD can help, again, vaping it, eating it, etc. The best thing with a bad trip is, of course, to relax.
Right.
And there are other products coming out too. I'm actually working with a company now that has like a nice little spray where it's like, you know, especially if you're a mom and you're like, oh goodness, just ate the edible, like gonna hang with my husband or something, and like something happens, you're like, your kid hit your head and needs to go to the ER and you need to sober up. Like those kind of things are important.
Right.
So it's like how to get unhigh is an actual real need. And sometimes
Excellent.
CBD helps, but it's not fast enough.
Right. Yeah, there's going to be products out there, and I hope you develop a good one. So, all right, where can people get your books?
Sure. So all of my books, except for Journal Yourself to Health, are available on Amazon or any of the big retailers. And if you want to buy directly from me, you can go to drmichelleross.com.
Please do that, people. Go right directly to drmichelleross.com. And thank you very much, Michelle. It's so good that we finally got to do this after about a 6 or 7 year wait. We needed the weather to clear up. So I appreciate you, and I thank you for educating everybody today.
Well, thank you. It was a great combo. And again, if anyone has any more questions for me, you can always reach me on Twitter too at Dr. Michelle Ross. I'm always on there.
Yeah, and check out her Facebook page, which has a 30-day mushroom challenge going on right now, and you can find more about that there. So I appreciate you, and we'll be back right after this.
This is the Medical Marijuana Radio Show with Larry Love.
Well, I want to thank
All love.
Dr. Michelle Ross. Thank you very much. I also want to thank my two radio mentors, both at the initials HS. If you'd like to be on the show, you can write us at info@mmjradio.com. Don't forget my Clubhouse show, Late Night with Larawana, every Friday and Saturday nights at 9 p.m. California time. And we'll be back next week with another great guest. And don't forget the CannaChannel.com and the Canna Channel on Facebook. We'll be right back next week.